Whether you're a clerk or a waiter, an accountant or a doctor, your health matters.
Hi, I'm Dr. Tarsila Tembo Peters. Welcome to Your Health Matters. On the program today, we will be looking at lumbar puncture. To help us explain what lumbar puncture is, we have Dr. Siddiqui from the University Teaching Hospital who explains. Meanwhile, let's hear what the public say.
Most of abantu wamepezeka kwa lumbar puncture sima survivor. So Chinese nani kafika pamena hapo sima nkana uja mtu wote ngankale willing kutini saini kuti mkazi wanga au mwana wanga asitechani she in the lumbar puncture.
I don't know much, but I just hear that it's some kind of a process that goes on when they want to test for like meningitis, whereby they have to get fluid from the spine. Yeah, I just hear that it's painful and it has to be done by someone who's a specialist, or failure to do that to result in paralysis or even death. That's all I know.
So why is there this idea, this myth, which I like the word myth, or misconception, that lumbar puncture causes death? So somewhere within the history of Zambia, somewhere along the line, this idea was introduced and it was adopted. And the story goes, again, I don't know I've never seen an article about this, is that someone had a relative who died who got a lumbar puncture, and they said don't get it because it causes death. So this is a misconception. So lumbar punctures, and this is the most important thing from this entire piece, is lumbar punctures actually save lives. They don't cause death, they save lives. Lumbar puncture is not a surgery, it's just a procedure by which to get fluid that's withdrawn from the back. So just like you get blood from the arm, your brain is actually surrounded by water, to just in simple terms. It floats because the brain's very soft. And sometimes that water, the fluid surrounding the brain, which is called the spinal fluid, can get infected. It can get infected with various things like TB, with viruses. And when the fluid that surrounds the brain gets infected, we call this meningitis, which is an infection, and a very serious infection. In fact, regardless of a lumbar puncture or not, a lot of people who get meningitis may pass away because getting an infection around your brain is serious. And there are many, many different kinds of meningitis. And so you need to know what kind of meningitis someone has before you give them the medicines to treat it adequately. So a lumbar puncture is simply sticking a needle in the back a couple of inches to access the fluid, and you withdraw fluid, you look under a microscope and see what kind of meningitis someone might have. When you get meningitis, it turns out that getting rid of the water is more difficult, so you kind of build up pressure, and that pressure is very painful. And that's the reason why you might get a headache, or you might get neck pain. Someone's very, very stiff. You might see them like this in the bed. So the lumbar puncture actually relieves some of that pressure because the water cannot drain properly. And so it actually can, patients get tremendous relief with meningitis often if they're not draining the water, the spinal fluid properly. A lumbar puncture is the best test and a very safe test to do this. In some ways, when someone has meningitis, but a patient refuses lumbar puncture and asks, can you do another investigation? You're asking the doctor to tie one hand behind his or her back to treat, because that's the best we can do. We do have alternative tests, but nothing can replace the lumbar puncture in terms of value. Most doctors are able to do a lumbar puncture within the course of their training if they've gone through medical school and reached a point where they're individually taking care of patients. They've been adequately trained on lumbar puncture. It's a fairly straightforward procedure, so you don't need to be a specialized doctor in terms of a neurologist or a neurosurgeon. You just have to have been trained on seeing it and then being observed how to do it, and then having done it successfully. In Zambia, I've done many, many lumbar punctures. Patients are very, very shocked at how quick it is and how easy it is, and then said, you're done. And then you realize it's just a Band-Aid you put over it because it's just a small entryway where you put the needle.
I have an aunt, she had meningitis and she went through that. The only thing she said was she was scared before. It's really painful, but she's now better. So I think if it's for someone to get better, then I would advise someone to do that.
The time where you should get a lumbar puncture is very early, when someone first starts getting neck pain or a headache and a fever, which are signs of meningitis. And that might be weeks before they get very, very sick. If you do it at that time, then you can look under a microscope, you can do the various tests, and you can start a medicine and someone can get better. But what happened is, because of this myth of lumbar puncture, for whatever reason that exists in Zambia, people, when they just have the headache, because they fear it, they say, no, I don't need it right now. My symptoms are mild. I don't need it right now. So they delay it, when actually they should be getting it weeks earlier. So what happens is they go home, maybe they just get treated. We do our best we can when they refuse a lumbar puncture. And then they end up coming almost, they can't walk anymore, maybe they can't even speak. And at that time, there's nothing left to do. We still don't know what we're treating. It would still be useful to have a lumbar puncture, though it would have been a lot better to treat someone early. Then they agree to it late. You do the lumbar puncture at that time, they're so sick that perhaps they die or they have a very bad outcome because of the disease. But because they've gotten the lumbar puncture late and there's this myth, families associate the lumbar puncture with death. And it sort of reinforces itself. It reinforces this very bad idea that it's the lumbar puncture that causes the death, when in fact, it's actually the disease itself. And people are only agreeing to it very, very late, and then they associate with it. If they had done it earlier, and this is what I'll advocate, if people get it done early, then we have a lot more time to treat, and people will see that actually lumbar punctures save lives.
Ndine Robert Kabinda naddala kambiri musana wenza kunivuta maningi sineze onyamuka na pabedi since last year August. Manje lumbar puncture banasebenzelapo, but apa manje nili bwino sineze kunyamuka pabedi loko kuyenda ku toilet loko kuyenda kuti nize gone for about 6 months. Musazi yopa kutula TV mababa loko chani vidi chabe bwino.
And the idea that a lumbar puncture kills someone is almost the same idea that a hospital kills someone. Certainly, people die when they come to a hospital because they're very sick. And this idea around lumbar puncture, it's the idea that people say, you know, don't go to hospitals. I had a relative, they went to a hospital and they died. And so people say, you know what, you're right. A lot of people that go to hospitals die. So we all know that the hospital isn't responsible for the death, it's the disease. And it's the same idea. It's the lumbar puncture is not responsible for the death, it's the disease, and that's the idea. But somehow, misconceptions are very powerful.
Abantu bamene mumayopa kuchita lumbar puncture musaziyopa mukaziboera bakazimichitani according na mamene namvelela ine.
I've done at least 500 lumbar punctures in my career, probably more. I've never had a death as a result of the lumbar puncture. There is a small risk of problems with lumbar puncture that at a bedside examination, you can decide that this person shouldn't get a lumbar puncture if you're worried about something like a tumor in the back of their head or something large that's there. But a simple examination can help you rule that out. I am pleading with the people of Zambia to trust your doctors, trust us when we say that a lumbar puncture saves lives. I don't want to harm anyone. It doesn't make any sense if I've taken an oath to help people, to help them through disease, to help them live long and healthy lives. Why would I do a procedure that would harm my patients? It just doesn't make any sense. Do not prevent your physicians from doing this procedure. Another thing I want to mention, delaying it. Often we have patients that have family meetings. We ask them with lumbar puncture, and they say, okay, I have a relative coming from Ndola, or I have a relative coming from Eastern Province. We'll decide in a day or two. You don't have time. Bacterial meningitis can kill people within a day. So that day waiting for a family meeting could mean someone's life. And you know what happens? People wait a day or two for the family meeting, they agree. We do the procedure because it's what we want to do, but it's too late. And then it just feeds on that. It's this cycle that needs to be broken. So hopefully we'll get there at some point, slowly.
Unlike what most people think, lumbar puncture is actually life-saving. This is Tarsila Tembo Peters. Join us again next week on Your Health Matters. Goodbye.
It matters, your health matters, yes, it matters, oh. Whether you're a student or a mother, a lawyer,